So the first question is, just tell us briefly, because I kept your bios very short, how you've gained insight into the experience of elders, what it is you've done, where it is you've done it. How did you come to this table? And may we start with you, Colette?
Can you hear me? So I would say that I have a lot. I look at the experience of elders and the insights that I've gained have been from varied settings. One is as a practicing physician for 7 years. Another was in terms of the care of an elderly aunt who lived to be 100 and my parents currently. Another is as the National Medical Director at Humana, where my focus is really on the associates and their dependents who have Humana coverage. I have also done the health disparities program at the NIH, the Scholar program. I've led health disparities work from another employer, and I've also done health and wellness coaching. So I've seen people in various settings and looked at the issues from a lot of different angles.
Great. Susan?
Okay. Hi, I'm Susan, and as Rima mentioned, I have been in a number of elder care situations, a lot of boots on the ground, but in the last 3.5 years, I have started a blog called Acting Our Age, Women's Lives at 85 Plus. I have interviewed about 40 women, ages 85 to 105, so there's 2 generations there. A bit about their past and a lot about their present. What are they doing? How are they managing? Just to get some insight, I would say all of these women are aging positively and healthfully, even though some have some very serious chronic situations. But they have been able to give me a good perspective. And I carry the responsibility of carrying their voices so that they also can be heard. They're a marginal group that don't often get the opportunity to sit down and speak to someone for a few hours. And so that's been my opportunity, and it's been very rich and very enlightening, and hopefully my readers feel that way as well.
Thank you. Yolanda.
Hi, my name is Yolanda Taylor Brignoni, and I am from AARP, which either will get a lot of cheers or a lot of questions about mailings. So apologies to set that up front. My job as a strategic communications director is to really take all of and AARP is a huge organization, and we have a good 35 to 50 communications vehicles that we use. And so my job is to make sure that we're communicating with one voice about health across all those channels. So really to make sure that we are delivering to our 38 million members the information, the tools that they need to make really great health decisions. And before I came to AARP, well, backing up before that, I was a health reporter. So I've been kind of doing health journalism, health PR, to this new role at AARP for quite a while. That's pretty much been my entire career.
Marianne.
So I've got to now say I'm not a strategic person or something. I certainly can't say it. This morning I said a little bit about my background, and the one place I didn't say much which was on the positive side, is the community links. I'm going to use this in terms of what have I gained in insight and knowledge around the community links. And I had mentioned Silver Spring Village. And I think their value to me, and I hope all of us to each other, has been certainly on the support side, reducing isolation, but finding that because these are a group of people, I didn't know one of them. We had all lived, most of us have lived in Silver Spring, which doesn't exist, but it's a place just outside of Washington, for 20, 25 years. And so the area we serve is maybe a 2 square mile area, 1 zip code. None of us really knew each other before. And so I have developed another community. And in developing that other community, I had the things I thought I would learn and get out of it. But I've also gained friendships and gained trust, and we have learned from each other in ways I hadn't expected and find I really need. Second is I talked about my Cheers locations. I have 2 coffee shops and 1 restaurant within my 2-block radius that I walk all the time. And there are a group of people that I know in each one of them. And I'll talk mostly about the one at the morning coffee shop. A roving group have gotten together over the last several years. We keep everybody that works at NOAA across the street sane. They come and talk to us and we talk to them. But we also talk to each other. And in that, we've gotten to talk about the concerns all of us have in aging, but what we have seen in our relatives and other kinds of links. And we have learned a lot from each other, not trying to tell anybody to do one thing or another, but giving ideas of things to go look into and to sort of find out we really aren't crazy if X is going on. One of the men, if it's too windy out and I feel I'm going to blow onto East-West Highway, he'll walk me back up the hill to where I live so I get there in one piece. And so there is a real bond that is health literacy linked and just keeping sane linked. My apartment building. I live in an apartment building of maybe 500 apartments. That's a high rise, first time I've ever lived in a high rise. And I was not sure how friendly people would be, how friendly I would be. And we're immensely friendly. All ages, all of everything. It's a mixture of anything one could want. And anybody from Silver Spring says we want a lot of diversity. Well, we've got it in that building. And what I have learned over the 2 years is sit out in front waiting for a car to come give me a ride to some doctor's office or whatever else. And the old people are the smokers. And so I'd sit out with the smokers. And they'd always check to see if it was okay, but they paid attention. And many of them have lived there over 20 years. They have helped me, and I said things that are going on, sort of saying, it's okay, you can live here. One of them, they had lived here for maybe 30 years. Her husband died 20 years ago and died in place. And she said, don't worry about it, it can be done. She didn't have to say anything else. So there's a form of health literacy that has come from all of those community groups that have been invaluable.
Okay,
so
I'm going to move on to the next question.
Yes,
Thank
please.
you. And so given your background, all of you, and given the fact that you sat through this long and really intriguing day, I wonder if you are willing to give us a reflection about a major insight that you've gleaned, whether it be from today or whether it be from your long history of work. Marianne, would you want to start?
Yeah, I think from today, a thing that's been very helpful to me is to learn words for sort of the phase 4 of moving into the action research and moving beyond the theory. Theory is absolutely needed, but I believe we are definitely at the point of needing to move to that next step of actually doing something. And so I am happy to have some words in how to talk about it.
Mm-hmm. Yolanda?
I guess one thing that really struck me as I was listening today was the whole, and this was something that my journalism teacher always said, is show, not tell. And I think that as you move into a profession, no matter what your profession is, there's always a certain jargon or a certain sort of language that goes along with it. And once you get into that profession, you're almost kind of proud to use that jargon because that kind of shows that you're a member and like, I know this and you don't, and you throw out all the acronyms and everything. And one of the things that my professor really pushed on us is that that is not being a good journalist. That's not being a good reporter. That's not good communication. If you are just throwing out words that no one understands what it means, you need to tell people what it is. And that has been something that, as a communicator, has kind of always stuck with me, that especially in this concept of health literacy, really thinking through what is it that you really want people to get out of things. Don't assume that people understand what co-payment and co-insurance is, because a lot of times people don't. And oftentimes when I'm looking at things, or we'll have like an article that comes from our ATM or our bulletin, and it'll be these terms, and I'm like, people don't understand what this means. I'm like, oh, this is so common. Everyone knows what this means. No, they really don't. And really making sure that we're building into our communications, whether it be in print, whether it be person to person, not assuming that people have that sort of institutional knowledge of what this means, because oftentimes it's your jargon, it's your industry's jargon. And in order to really get to that trust, that communication, that sort of community that we've been talking about all day, that takes breaking down those silos and really introducing people into your club and introducing them to what the language is of that club and just opening that spirit up.
Right. Susan?
Okay. One thing that really struck me earlier today was when we talked about ageism and talked about ageism among the elders. But I wanted to talk about it more broadly, and that is really why I started the blog, and that is because we're a very youth-driven society, even though that wonderful map that was shown before that we're switching places and we're going to be much older before we're much younger. This is a society that is so fearful of aging. When you're 20 years old, the cards you get from your friends for your birthday is about wrinkles and sagging bodies. I mean, and we think that's funny. There's a lot of life from in every one of these situations to get too trapped into that sense of old, you're old, and what that means. The stereotypes that I've really seen challenged through this are, through my blog, are rigidity, crankiness, depressing, and depressed. Those are some of, and unwillingness to kind of learn or move forward. And in the 40 people that I've spoken to, it's not a global mass of people. But they're pretty ordinary people, and I have seen I've heard some wonderful stories about even, we hear about this a lot, people who in their 80s have moved to a new community to live a mile from their child. What is involved in that is downsizing, packing, saying goodbye to possibly a house you were in for 40 years, moving to a community you've never been to before outside of visiting your son. And suddenly you have new neighbors. That kind of resilience is something that is very striking and really needs to be admired and acknowledged. The adaptability. People who have, one woman, Muriel, said to me, I said I would never use a walker. And then I realized I was sitting in my room all the time. So if I want to get out of my room, I need to use the walker, and that was that. The openness to learning. I actually have been very, very impressed by the number of people I've run into who are on their computers, they're on Facebook, they're FaceTiming with their grandkids. They understand that the world has a new language, and some are able and willing to venture in. Mostly they're taught by their grandchildren, so there's a nice intergenerational opportunity there. But they're using Uber and Lyft, and so these things are starting to happen, and it's pretty, I think it's very exciting. The other thing is coming to peace with their lives, which I have really been impressed with. A number of these people have buried children, have been in bad marriages, have been told by their parents when they grew up, you're not worth sending to school, you're a girl. And despite that, they're at, I think, a number of people were really at a sense of peace, not filled with regret, not filled with anger, happy, blessed to be where they were today. Okay. I also wanted to just say one thing about caregiving. And the one thing that we didn't talk about is when the caregiver himself is elderly and has medical issues. And my father with colon cancer was my mother's primary caregiver. And what was amazing was the doctor never said to him, what's your life like being a full-time caregiver for Miriam? Never mentioned it. And it was very key to his overall health.
Okay.
So for me, what I would say is that today really drove home something that I have believed firmly for forever, and that is the importance of really listening to people and that despite all the technology and all the advances, it still comes down to people. And every time we try to take people out of the picture, it does not work out well, and everybody seems surprised. And I don't get it. The other thing is that when you really focus on trying to fix something for a person or a group, given the state of the healthcare system here and lots of other places, you are walking into a quagmire that is systemic. So if you really, really are focused on fixing it for that person, you're actually fixing it for everybody. Because I always feel when you think about the types of things that are designed or sometimes not designed for someone who may be older, very rarely is it the case that I'm not saying, well, I want that too. I want that too, because what is it? It's simplicity, it's connection, it's something that makes sense, it doesn't take a lot of time, it makes your life easier, it doesn't take up more time. The other observation I would have, and I would see this with my aunt, for example, is relative to the ageism where I might accompany her on an appointment. She had hypertension and arthritis, and that was it. There was no cognitive issue when she was in her 90s, but yet the healthcare practitioner would be asking me all the questions, and she's sitting right there. And I'm like, hello, right there. She knows what she's talking about. But I think there's something in the system that after a certain point, the system stops seeing people and stop seeing what their capabilities are, and then you get into, it becomes easy for the patient to learn to be that person, even that's not who they are, and learn to be their condition, even though that has nothing to do with the essence of them. So today has just further reaffirmed that for me, and the importance of us to address the issue and not kind of buy into where the system is trying to push us.
Okay, well, Colette, you sort of answered the next question in part, but I'll still give you a chance to have more to say about that. So in a sense, we've heard about something from the perspective of elders and the importance and need to appreciate both the resilience that people have and to appreciate the bias that they're facing. And three of you also focused on issues that really need to be addressed by us, those of us in this room, who are responsible in health systems, in policy developments, in the kind of research or implementation studies that we might do, where the fix is. So really the third question is the action part. What can you draw from your insights that you could tell us that we need to take pay due attention to as far as health literacy is concerned? How can we translate these insights into actions within the healthcare institutions, within the public health systems? What can we do based on these insights?
So I told Kim, who is my partner in crime, is the reason I'm actually here today. Thank you, Kim. How excited I was getting because of an area of focus for me this year is around caregiver support. And one of the things that we're going to do is an advocacy boot camp, because I feel that people don't recognize the power that they have. And it's really very, very important to me. And just to kind of give you an idea of like how I am wired, I have a blog that's Be a Healthcare Rebel, so that should tell you something right there. And it's also the case that I feel like no one is going to really know what you're thinking except you. No one's ever going to know what you're feeling in your body but you. So you are the expert of yourself. So you start from that position. And the need to trust your gut, and if something doesn't make sense, it probably doesn't make sense. And it doesn't matter how many degrees someone has behind their names and how many big words they're using. And just gaining the skills to also have the confidence to ask the questions, because it's not minor. It might be something that is literally going to save your life or the life of your loved one. And so, I mean, that is one thing that we are going to be working on. And I just feel like general advocacy in the healthcare system, you see it with parents with little kids. There's like nothing will deter them from getting what they want for their child. And we just need to infuse more of that and more people in the system. And that's just the system will have to respond.
Do you envision your advocacy boot camp to be for patients as well as caregivers?
Yes.
Great. So question authority.
Yes.
Susan?
Well, one thing that I think about a lot is how this idea of storytelling could be put into good use. And I do know that there are some groups and some organizations, some Alzheimer's Association training to really help staff at nursing homes, assisted living, really take the time or read a description of the person and then talk to them and find out who they are so that they become someone different. I think the need to be, or not someone different, they become someone real. I think that needing to be heard and needing to be seen by a medical provider is really important. And I have one example. Janice, who's 86, was telling me she had a lot of swelling of her hands and her feet. And she went to the doctor 3 times, and 3 times was told, go home and take a Tylenol, which essentially is, you're old, there's nothing to do. The 4th time, she basically announced that she was not leaving her seat in the office until they did some tests. And they did some tests, and she had rheumatoid arthritis, and she's getting some treatment for that. She is African American, so I was thinking, Stephen, about what you were saying about how much is this racism and ageism. And she talked to me about how it felt like the segregated South where she grew up, because her health wasn't important there either. The other thing that interests me about that is her daughter is an MD and would come to every appointment. So there clearly was somebody there who had a lot of health literacy, but was still not really focusing on Janice. But if the provider had looked at her and took the time to find out, they would have discovered that she was responsible for diversifying the book collection at Amherst College Library. When she went there, when she first started working, there were 5 books written by African Americans, and she helped launch a whole cultural center. So she was a lot more than swelled feet and hands. The one other thing I wanted to say, though, is when I worked in senior housing, subsidized senior housing in Boston area, we have a really exciting program with Tufts medical students who for an entire semester would spend 1 afternoon a week, so it's probably 17 weeks, with a group of elders. And they came with their mission was to learn to listen, which is pretty exciting. And there was such an opportunity for the future doctor and the residents to get to know each other that at the final goodbye, there were several students who stood up and said, I was afraid to come here. You guys rock, and I want to be a geriatrician. And that's what I think we need to look at, is that, and that was very similar to the barbershop idea. People need to have that experience.
Great. Yolanda.
So mine is also a little bit about trust, which we've been talking about a lot today, and really trying to make sure that we are investing in that trust and breaking down the silos. I'm going to be piggybacking on a lot of what you were saying, Colette. There's just so much of you need to go where people are. There's just so much baggage, and there's so much, it's just so easy to write people off. And especially if you're in sort of a medical situation, you see this person, and unless you really get to know them, they become this category of symptoms or ailments or conditions, or like, okay, this person has this, and this. They're probably not doing this, and this. Here's what they need to do. And I love the example that was given this morning about the reason the woman wasn't going to her doctor's appointments because she had a 3-story walk-up, and she needed someone to physically carry her downstairs in order to get to her appointment. And you would never get to that unless you actually break down those silos, you get to know the person, you just establish that trust, and then that person feels safe enough to tell you, this is what I'm going through. And you're not going to judge me because I feel like I know you well enough and you know me well enough that I can have this sort of exchange with you of, I don't really understand what that means. Or thinking back to the videos we saw too of people, and I can imagine it was probably a little embarrassing for them as they're going through and they're like, okay, can you explain to me what this means? How are you going to take this medication? What does this mean to you? To have the space where you can be open enough to ask those questions. I think a lot of the things that we've talked about as far as literacy and people not feeling like they have the space or the opportunity to ask those questions would be broken down if we had that sort of community, if we had that sort of trust where you know this person lives in your community, their daughter might be a part of your, Girl Scout troop or whatever. So there is that kind of connectivity that unfortunately we kind of have, we don't have as much anymore. And one other piece that really kind of stuck with me too is the technology piece. And while technology's great, if at the end there's always human error, you kind of have to have somebody who can, show you what to do, or here's the best one for you, or give you that sort of step you need in order to be able to get down that path. So really figuring out how we can come together more and really build that trust in communities, not only between healthcare providers, within communities themselves. So if I am in a village and I have help and like I need to go to the doctor, but I don't know how to get there, or I have this other issue that's going on and I'm kind of embarrassed and I don't know what to do, but I feel open enough in my community that I can ask you, like, hey, I have this going on, what can I do? So really figuring out how we can best really build and leverage that trust.
Thank you. Marianne.
I agree with all that. I want to mention a couple of things that are related. I probably in building trust been also learning to listen. I think I have a couple of examples. One was one of the early times, I think in 2016, in having visiting nurse support. And I had two different people. One was the real sort of the nurse caregiver around medication, and the other was a physical therapist, both good at what they did. And what I found, well, a couple of things I found as we went through this. One, the nurse was looking at what was going on with me in terms of, she knew I had long-term care insurance. What did you have to do to qualify for long-term care? The physical therapist saw me with my, the typical little gray walker, and heard me say, well, I want to be able to go out and walk here, walk to Pete's and get coffee and do this, that, and the other thing. And he looked at my walker and said, in essence, you'll kill yourself if you keep that walker. You need something that will hold you up. And he was thinking of one with a seat. Well, that's too heavy. If we're going to do this, I want to be able to carry it. This one's 9 pounds. I can still get it in the back of my car for a while, and I certainly can maneuver around with it. I hadn't realized before we started the conversation with the two doctors, the patients know what they want. Yes and no. I couldn't have articulated to the nurse that what I really want, my definition of independence is being able to get out of my apartment for as long as I can, however I can. That interaction got me to be able to define what I needed. So it ended up being helpful in a very strange way, and clearly you can see the direction I went. The note-taking, that whole process has been exceedingly helpful in improving communication, and that's what I've gotten through the village. The other thing is an example, and there should be a better way to do it, quicker way to do it. But the first time I was in the hospital, you get all the pills to take care of if you have pain, and then if you have this or you have that, and they all have side effects. And what we found is, number one, I don't have pain, so that question is the wrong question. But I was taking all the pills, and I was getting all the side effects. And so I was not recovering. I couldn't eat. Everything that was going wrong, one pill was being counteracted by the other. And it took us a couple of weeks to figure out that that was really the problem. But the doctors were good enough, able enough, because they told me, we got in a conversation, I said, you're not going to have these when you go home. And I said, well, why do I need them here since clearly it's not working? So we just went cold turkey and stopped taking them. And I got healthy and then was able to go home. But without that, and since then, they have prescribed the minimal medicines because they know what I want, I know what I want, and we know how I react. So there have been various ways we've learned to communicate, and that's where some of these other things then link together.
Interesting balance between an emphasis on advocacy, on telling and collecting stories and making the invisible visible and more real, and listening. Seems to be resonating with all of you. Can we take just a moment just to go down the line again and just share either something you've gleaned from today or might have been missing from today or that you'd want to emphasize before we turn it over for Q&A?
So it strikes me there's now knowledge in the medical community about the impact of maternal health, not just on the baby at the time, but the next generation. So what you do when you're pregnant has the potential at a cellular level to impact your grandchild. And so it strikes me that with regard to a caregiver situation, that it's really 3 generations potentially. So it's the person receiving the care, it's the person who's the caregiver, and then if it's the typical woman who's in the middle, you've got 3 generations at a minimum. And kind of to your point, if the caregiver already has problems, it's a bigger problem. And if you don't have problems, you very quickly will find yourself challenged. Because I have seen myself just when there have been times when I've been in an acute situation with my parents, I know all the things I should be doing, but the healthy eating, the physical activity, all goes flying out the window. That's a couple or weeks at a time, but over a sustained period of time, what are the actions that can be taken so that you don't end up with 2 people who've now got a major problem? So I think that, at the beginning and towards the end, you kind of are ending up with that multi-generational impact.
Can I put a positive spin on that?
Yes.
So from a personal perspective, me taking care of my mother dying over the course of a year in my home, my son observing and being part of that, made him a fantastic husband and father. So the intergenerational is not only that burden, but it's also that opportunity for observation, for learning, for compassion, for taking the next step. So I just wanted to balance that out with you, if I may. Right.
Well, being here today was really very special. We're wearing my blogger's hat. This is a new opportunity for me. And I feel really hopeful. I feel like there's a lot of potential among the people that we're talking about and the providers and the technology, and we know what needs to happen. And hopefully it won't take that long for people to realize they need the time to just sit together, get to know each other a little bit, see beyond the symptoms, and have the opportunity to really assist people and see them as a whole person. And by doing the blog, I've had that privilege, and I think it's really important that care providers have that as well.
One issue that I would love for us to spend more time on, but I know we just had a lot of stuff that we were going through, was just a little bit more on the family caregiver and just because they are under so much stress and because they have so much on them, what sort of resources and what sort of support can we give them? Because they are a very critical part of this equation, that they're the ones who are in the doctor's appointments, taking the notes and driving the people to appointments and doing all these roles. But one of the things that we at ARP, we have a whole caregiving program, and one of the questions we always get is, what can I do for me? I am so stressed out. I don't want to let my mom down or whoever I'm caring for. We do have a lot of people who are, their children are away, so they might be caring for neighbors or friends, and just feeling so disconnected, but also not wanting to push back or just say I'm overwhelmed because they feel almost guilty about it, of like, okay, here I am just feeling like I just need a day off, and this person's having all these issues. And really just spending a little bit more time and figuring out what can we, as a part of the system, really put in place to kind of care for the caregiver.
I think the only thing I would add to that is, I looked again, is we're talking about health, and much of what we're talking about is the stress on everybody that's dealing with it. And so the caregiver has all the stress, the patient has the stress, and there have been several times we've brought up sort of the community. Those are some of the community links, the estate planning kinds of stuff, other things that can reduce the stress so that you can pay attention to the health, because the health, number one, will probably be not getting any worse because of the stress. The stress just hurts the whole system.
Okay. If we're lucky, we're all going to get old and older and be in that other group of old. And so thank you very much for your reflections, and with a deep appreciation for your work and experiences that really helped you bring those reflections to the table. So with many thanks before we turn to question and answer. So I just want to lead the way.